From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Good morning, folks. This is Dr. Paul. Thank you very much for tuning to our channel today. Today I want to talk a few minutes about ear infections, especially the microorganisms that cause ear infections. Many times we think about bacteria, but we forget about viruses. You see, respiratory syncytial virus and influenza virus, they have been consistently shown in children with ear infections. When you do cultures of the ear fluids, you always find some virus along with bacteria in many cases, especially from January to May. And most commonly you see the viruses, respiratory syncytial virus and influenza virus, and they surge from January to May in temperate climates. The two viruses, we have not found a clear link, but you always see them going along with the ear infections. Many times they cause adenoid hypertrophy and eustachian tube dysfunction, predisposing the children to the ear infections. And also in the United States there is a variance from northeast to the southern areas like Colorado. In northeastern areas, Streptococcus pneumonia is the common cause, whereas in Colorado and other southern states you will see Haemophilus influenza, especially after the introduction of pneumococcal vaccine. Streptococcus pneumonia is decreasing, Haemophilus influenza causing streptococcal ear infections are increasing. Now, in this lecture, I want you to remember four things: Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, and Streptococcus pyogenes. These are the four most common organisms that cause ear infections. Now, Streptococcus pyogenes, the fourth one, is commonly seen in school-aged children than infants, and it is along with Streptococcus pneumonia is a common thing in mastoiditis. So Streptococcus pyogenes is a common cause of mastoiditis and acute otitis media. Now, Streptococcus pneumonia is a common cause. As I said, Streptococcus pneumonia and Streptococcus pyogenes, these two organisms are common causes for mastoiditis. You should always have an eye for complications of ear infections in these patients, because that happens. I saw a patient recently who came with ear infections, and then 2 weeks following that he got mastoiditis because he developed antibiotic resistance. The other thing is in infants less than 4 weeks age, we see gram-negative bacteria, especially in children who are hospitalized, infants who are like in a neonatal intensive care unit. So below 4 weeks of age, gram-negative bacteria is a common cause for ear infections. You should always remember that fact, because you try on treating them with all these common antibiotics we use in other children, but if we forget about gram-negative bacteria, we do not use the antibiotics that have coverage to treat those infections. Now, we have been using penicillins and macrolides for so many years now, and unfortunately many of these strains develop resistance to these antibiotics. But we have been trying other medications now, like a high-profile cephalosporins or clindamycin. And so I'm going to talk about that after I talk about this basic problem. So remember these four strains, folks. And then remember about penicillin allergy. Many times we start these patients with amoxicillin. Amoxicillin is the first line of treatment, and it is good because it is safe and inexpensive and relatively easy to use. But the problem is many patients are developing resistance to this problem. Back while I was in India, it was Bactrim. The whole hospital We used to use Bactrim on everything. And it worked well. Bactrim was all the antibiotic you need. And it was so inexpensive. And thankfully it was working. But unfortunately, Bactrim is not working anymore. Now amoxicillin. In many cases, amoxicillin is not working anymore. And we have to go for augmentin. And augmentin fails, we go for Omnicef and all that stuff. So you see, antibiotic resistance is increasing. And in penicillin, it goes like with bacteria develop these stepwise mutations. And the 3 penicillin binding proteins, they change their shape. But the good news is, in spite of all the penicillin resistance we have, there are medications coming up like clindamycin, rifampin, and fluoroquinolones. So remember, clindamycin, rifampin, fluoroquinolones are good choices for penicillin-resistant organisms. But the other important point is fluoroquinolones are not yet approved for children younger than 16 years. That's an important point. Fluoroquinolones are not yet approved for children younger than 16 years. So you take the whole profile. Let me recap, I will finish. 4 organisms: Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, Streptococcus pyogenes. Streptococcus pneumonia and Streptococcus pyogenes are the common causes of mastoiditis. Streptococcus pyogenes is commonly seen in school-aged children. In infants younger than 4 weeks of age, you should think about gram-negative bacteria as the causation of ear infections, because the profile of antibiotic coverage changes. And think about antibiotic resistance. Bactrim. I'm not saying Bactrim is completely useless, but Bactrim may not work in so many cases. Then you go for amoxicillin. Amoxicillin is good, the first choice to treat acute otitis media, but it may not work in some cases. So you need close follow-up of these patients. And I also mentioned about the viruses. Respiratory syncytial virus and influenza virus are commonly seen from January to May in children with ear infections. So those are the important things. Always feel free to visit our website www.drpaul.org www.drpaul.org. Thank you very much. Have a nice day.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.